Hi, I'm Shelley Kidder, a nurse in the Education Department at Baptist Memorial Hospital Golden Triangle, and a first responder for Mid-South Transplant Foundation. Tonight, we will discuss how the transplant process works. Even though millions of people have registered to be an organ donor, very few die in a way that lets them share the gift of life. Let's look at how the process works. The process of donation most often begins with your consent by registering in your state. In order to be a deceased donor, a person has to die in a very specific way or is put on artificial support to keep blood with oxygen flowing to the organs. After a series of tests to determine brain death, the hospital notifies the local Organ Procurement Organization, or OPO. The OPO searches to see if the deceased is a registered donor. If so, that will serve as legal consent. If the deceased is not registered and there is no other legal consent, such as a notation on the driver's license, the next of kin will be asked. After authorization, a medical evaluation takes place and the matching process begins, with a search of the national database of all patients in the U.S. waiting for a transplant. While the search for a matching recipient is underway, the deceased donor's organs are maintained on artificial support. A transplant surgical team replaces the medical team. The surgical team removes the organs and tissues from the donor's body in an operating room, and they are transported to the hospitals of the intended recipients. The transplant operation takes place after the transport team arrives at the hospital with the new organ. The recipient may already be in the operating room awaiting the arrival of the life-saving organ. If all goes as planned, the organ donor has possibly impacted the lives of up to 8 people with his or her gift of life. Join us next time for Health Talk with Baptist.